I am Kate. I am a DNP student at the University of Mary, and if it's okay with you, I'll be doing a complete history and physical on you today. Is that okay?
That's fine.
Okay. I've got a clipboard here with a piece of paper. If you don't mind, I'm going to be jotting some things down as we go, just so that when I go ahead and put your information in the electronic medical record, everything's accurate, nothing's forgotten. Is that okay?
Sounds good.
Okay. I'm going to grab a chair, and we will chat.
Okay.
Okay. So your name is John, correct?
Yes.
Okay. And John, what brings you in today?
For a physical,
Okay.
my insurance changed, so I thought I'd have to find a new doc. So
Okay.
That's why I'm here.
Okay. When was your last physical?
2022.
Okay. Everything was normal in that physical? Did they anything?
They said I had high cholesterol.
Okay. Did they put you on any medications at
No.
that time? No medications. Were they just going to monitor it with diet or?
Yes, it was slightly elevated.
Okay. Okay. And how old are you, John?
53.
Okay. Have you had a colonoscopy before?
Yes, I have.
And when was that?
It was 3 years ago.
Okay, and that was normal?
Normal.
That was normal? Okay, and the follow-up on that, did they say?
10 years.
Okay, so did they find, they must not have found any polyps based on
No.
that, is that correct? Okay, any history, or when was your last eye exam?
3 years ago.
Okay, and do you wear glasses, do you wear contacts, are your eyes okay?
I have to use readers.
Okay, when was your last dental exam?
6 months ago.
Okay, everything okay with your teeth?
Yes.
Okay, great. Have you ever had surgeries or been hospitalized before, John?
When I was 15, I had shoulder surgery,
Okay,
my left shoulder.
okay,
When I was 2 or 3, I had my tonsils out.
okay,
But that's the extent of my surgeries.
okay. And no complications from those?
No.
Okay, all right. And John, do you have any allergies?
I'm allergic to bees.
Or what happens when you get stung by a bee?
My last time, extensive hives,
Okay,
swelled up.
okay. Have you ever heard the term anaphylaxis?
Yes.
Okay, is that so anaphylactic reaction?
Yes.
Okay. Do you carry an EpiPen?
I have one. I don't always keep it on me.
Okay. Bad. You should keep it with you.
Okay.
Okay. So any drug allergies, food allergies?
No.
Okay. And are you taking any medications currently?
Just a multivitamin.
Okay. How often do you take a multivitamin?
Once a day.
Okay. No other medications?
No.
Okay. John, tell me about your diet. What kind of diet? What's your typical diet like?
I would say the normal American diet. Nothing special.
Okay. Normal American diet would be hamburgers and French fries. Fruits and vegetables. Do you eat fruits and vegetables?
I do.
Okay, how often? About how many servings of fruits or vegetables do you have a day?
1 to 2.
Okay. Do you what type of do you eat out dinner a lot? Do you
Seldomly.
seldom? Okay. About how often?
Once every 2 weeks.
Once every 2 weeks. Okay. So most evenings, so you eat dinner at home. Are they home cooked meals? Do you
Home-cooked
order out?
meals.
Okay. Okay. And what types of things do you eat? Proteins, whole grains?
Balanced diet.
Okay. Lean meats, chicken, fish. You guys eat chicken, fish, beef, all of
Yes.
the things? Okay. Okay. Great. And how much water do you drink a day?
Quite a bit.
Okay. So at least 8 to 10 glasses? When you say quite a bit, would that mean at least 8 to 10 glasses?
At least 8 to 10.
Okay, great. Do you drink soda pop?
No.
Okay. Do you drink any caffeine intake?
Coffee in the morning. I'd
Okay.
say 2 to 3 cups before noon.
Okay. No
Nothing
caffeine afternoon.
afterwards.
Okay. Smart. And what about sleeping habits? What are your sleeping habits like?
I'd say 7 to 8 hours a night.
Okay, that's good. Do you have any trouble falling asleep at night?
No.
Okay. All right. Tell me about are you married?
I'm married. I have 4 children, 2 living at home.
Okay. Okay, 2 living at home. What about your work? What do you do for a living?
I'm a dentist.
Okay. Do you work in a practice? Are you self-employed?
Self-employed, solo practice.
Okay. Do you have access to health care?
I do.
Okay.
I
You
have.
have good medical insurance?
Decent medical insurance, private.
Okay. Do you belong to any type of church? Do you have, what are your religion, or do you have a religious preference?
I'm a Roman Catholic.
Okay. And do you practice your faith?
I do.
Okay. Attend mass regularly?
Yes.
Okay. And do you do any activities at your church? Do you stay active in the church?
Active in the church.
Okay. Belong to any committees?
I do.
Okay. All right. Good. And so you're married. I going to assume, are you sexually active?
Yes.
Okay. Do you practice any forms of contraception?
No.
Okay. Okay. Right. Okay. I'm going to ask you a little bit about your family. Okay. Are your parents living?
They are.
Okay. And how old is your mom?
She is 79 years old.
Okay. Does your mom have any health problems?
She does. She had a ulcer in her small intestine.
Okay. When was that diagnosed?
6 months ago.
Okay. Any other health problems at all? I know that you said you had high cholesterol. Is that something that runs in your family?
It runs in her side, yes.
Okay. So your mom
Super
also
high.
has high cholesterol. Okay. And what about your dad?
He has cardiovascular disease.
Okay. How old's your dad?
He's 82.
Okay. And his cardiovascular disease, has he had any procedures, any surgeries?
Yes, he had a couple stents placed.
Okay, and when was that?
3 years ago.
Okay. Any siblings, John?
I had a brother who died at 20.
Okay. And how did he die?
Suicide.
Ooh, that's very rough. I'm sorry to hear that, John. Okay, how about your grandparents? Do you know anything about your grandparents on your mom's side?
My grandmother on my mom's side died of lung cancer.
Okay. Okay, and what
And
about
my
your grandfather?
Grandfather died of brain cancer.
Okay. Okay. Do you know how old they were, what their ages were?
I'm going to guess my grandfather was 62,
Okay.
and I'm going to guess my grandmother was 84.
Okay. So not terribly sure, but you knew that. Okay, so your grandfather was 62 and had brain cancer.
He was exposed to radiation.
Okay,
In his
for
line of
work?
In
Oh,
his
for
line of
work. Okay. And your grandmother had lung cancer. Was she a smoker?
Yes.
Okay, how many years did she smoke?
Probably 50 years.
Okay. Okay. And those were your mom's parents. What about your dad's parents?
My grandfather on my dad's side died at 48 of a heart attack.
Okay. So just dropped dead with no known cardiac history at the time.
I believe they thought he had an aneurysm before.
Okay.
He had odd EKG readings
Okay.
before.
Okay.
And my grandmother died at 95 of old age.
Old age?
Yes,
Okay.
her body stopped.
Okay. Was she with it? Was she,
Toward the end, she wasn't, but the majority
just
of
a
that
little
time
bit
she was.
forgetful, kind of
Yeah.
like, okay. Not ever diagnosed with Alzheimer's or
No.
anything like that. Okay.
No.
All right. Okay. So let me ask you a few questions about you. Do you have any? You said you were readers, okay? But do you have any other problems with your eyes? Have you ever, do you tear up easily? Anything like that?
No.
Okay. Do you experience any frequent fevers, headaches, chills, anything like that?
No.
Okay. No headaches, dizziness?
No.
Loss of balance?
No.
Anything like that? Do you have any problems with your heart? Do you have palpitations? Do you have chest pain?
No.
Anything like that? Okay. Have you ever had a cardiac workup before? or just routine labs?
Just routine lab,
Okay.
routine EKG.
Oh, that's right, the high cholesterol, right? Okay. What about your lungs? Have you ever been diagnosed with anything in your lungs? Do you have any difficulty breathing, any wheezing, any coughing, any frequent chest tightness?
No.
Can you breathe? No. Okay. Do you have any problems going to the bathroom?
No.
What about your bowel habits? How often do you have a bowel movement?
Once a day.
Okay, pretty normal?
Normal.
Okay. Any, how about urination? Do you go to the bathroom frequently? Do you feel like you have to go all the time?
No, nothing.
Okay.
Everything seems
Do you
to be
feel like
normal.
do you wake up at night having to go to the bathroom very often?
No.
Okay. What about any backaches, any, spine problems, anything with your muscles, bones, or joints? Do you have any joint stiffness, any swelling?
No.
Anything like that? Okay, no problems with your knees,
No.
arms, legs, anything like that? Okay, good. What about your skin? To your knowledge, I can see that I'm not visibly seeing anything right now, and I will do a better job of looking you over, but do you have any problems with rashes, bruises, lesions, anything like that on your skin?
No.
Okay. What about psychiatric history? Do you have any history of any psychiatric illnesses? Do you ever feel sad, depressed, or anxious? Have you ever had thoughts of suicide before?
No.
Okay. Lymph nodes, do you feel like your lymph nodes are swollen? Do you have any problems with swelling, pain, anything like that in your lymph nodes? Okay, great. Any problems with your throat, any soreness, hoarseness, anything like that, or any?
No.
Okay. Teeth, your teeth are okay. I know you said you had an appointment 6 months ago with the dentist. No loose teeth, no missing teeth. Okay. Tongue feels okay, not sore, no lesions on it, anything like that. Okay, good. Let's see what else I can ask you. I think that's about it in terms of going over what you have. What I'd like to do next is a physical exam, okay? And we're gonna kind of go from top to bottom, okay? And look you over and make sure that you're healthy, okay? I'm gonna first wash my hands, put some gloves on, okay? And then I'm gonna take your vitals. Sorry, should have done this first. I like my little thingy hooked up there. Right back. And just relax your arm there. I'm going to pretend this table's high enough that I don't have to strain here. Good. 121 over 73. Very good. Okay. Okay, pulse is 68, very good. Respiration for 16. And we're going to pretend I have a thermometer, and you're going to put this under your tongue and take your temperature. 97.6, great. And why don't you come over here to the scale, John? Let's get your height and weight. Let me find my tape measure here. There we go. Come hop on over. The scale, just step on up there. My glasses here. 157. Come on out. And go ahead and put your heels up against that wall. I don't have one of those super fancy. Okay, there you go. You can step aside. I wish I had one of those big, long measuring sticks. Okay. Got your height and weight for 68 inches, 5'8". Does that sound about right?
Yes.
Okay. All right. Okay, so first thing I'm going to do is kind of take a look. Okay. Look at your head. Symmetrical. No lesions, no scalp abrasions, no palpable hematomas. Good, good. Ears are symmetrical. Okay, eyes symmetrical, nose. Good. Take a look at your ears here. Okay, I see the tympanic membrane is gray, the cone of light. Okay. Pearly gray tympanic membrane with the cone of light, great. Any tenderness when I touch those earlobes at all?
No.
No? Good. Okay. John, I want you to take a look at my pen, and I want you to follow wherever it goes, okay? Don't move your head, just move your eyes. Feel like you're going a little crazy? Okay. All right. Now, you just look straight ahead. I'm going to also pretend that my pen light charged and that there's light. Take a look at me here. Okay, good. And I'm looking for pupils to react to the light, to shrink down in the light, come back. Red light reflex. Very good. Okay. I'm going to take a look in your nose. Any problems with drainage in your nose? Looks like your nares is patent. No deviated septum. Good. Any frequent runny noses or anything like that?
No.
Okay, good. What I'd like you to do is open your mouth real wide and stick out your tongue. Stick it way out. Again, let's pretend this pen light actually works. Okay, good. Good. I can see you don't have tonsils. Okay. So we can't grade those. All right. Take a look at you here. I'm going to just feel around a little bit, okay? Feel for those. Take a look at your tongue real quick. Stick it out. Okay. Smile for me. Frown for me. Okay. Cranial nerve 7 is intact. Forgot to do this. Sorry. Okay. Go ahead and close your eyes. Okay. Tell me if you feel soft or sharp on your cheek.
Soft.
Okay.
Soft.
Okay. Let's keep your eyes closed.
Pointy. Pointy.
Okay. Is that another term for sharp?
Could be.
Okay. Yes, it's supposed to be sharp. Okay. Cranial nerve 5 is intact. And I want you to keep your eyes closed. I'm going to ask you to take a smell. And then I want you to tell me what it is that you're smelling, okay? Okay. Take a smell. What does that smell like?
Frankincense.
Very good. You got a frankincense essential oil. Okay, you can open your mouth, or I'm sorry, open your eyes. Cranial nerve 1 is intact. Very good. All right, I'm going to go ahead and feel here. Go ahead and orbital lymph nodes. I'm going to feel around here. Preauricular. Okay. Submandibular. Oh, there's our resident dog that likes to come in when I'm doing exams. Okay, any tenderness, any pain as I'm feeling around here?
No.
Okay, good. Supraclavicular, I'm gonna feel some in here. Any tenderness there?
No.
Very good. Okay, great. Awesome. Okay, now I'm going to, where did I put my, oh, there it is. My stethoscope. I'm going to go ahead and take a listen to you, okay?
Sounds good.
Sounds good. All right. Kind of sit up straight for me. Very good. S1, S2 are audible. I'm going to take a listen to your neck here. Okay. No bruise in your carotid arteries. Very good. Now I'm going to listen to your lungs, okay?
Mm-hmm.
Every time I put the stethoscope down, I want you to take a nice deep breath in and then blow it out, okay? All right. Breathe in. Out. Okay, and come around your back here, same thing. Nice deep breath in. Okay, great. Lung sounds are clear in all areas. No adventitious breath sounds. Great. So now the next thing I'd like to do is I'd like to assess your abdomen, okay? So what I'm gonna have you do, my little notes that I've been taking here, is go ahead and lie down with your feet toward, well, yeah, why don't you lie with your feet? There you go. Okay. And the first thing I'm gonna do, I'm gonna just kind of take a look. I'm gonna lift up your shirt and I'm gonna do an inspection, okay? Alrighty. I'll be looking for symmetry, okay? No lesions, no masses, okay? That's good. Now I'm gonna listen for your bowel sounds, okay? Okay, bowel sounds are normoactive in all 4 quadrants. That's a good thing, okay? And now I'm just gonna kind of touch, do some palpation, see, feel around a little bit, okay? See if there's anything concerning. Do you have any pain when I touch? Any tenderness?
No.
Okay. Okay. Nothing hurts there. Nice and tender. Great. Okay. I might go a little bit deep here. I'm going to feel for your liver's edge, okay? So what I'd like you to do is take a deep breath in and hold it. And you can let it out. Okay, good. Great. All right. And I'm just going to kind of bang on your belly a little bit and listen for some sounds here, okay? Okay, we got tympany and then dullness right at the liver edge. Same thing on this side. Okay. Over by your kidneys. Okay. Great. Did anything hurt?
No.
Any of that hurt?
No.
Okay. All right. Okay, you can go ahead and sit up here. Okay. Bring your legs around. I'm going to do a couple of tests on you. So, all right, so sit up straight here. Go ahead and shrug your shoulders for me. Open back down. Okay, good. Well, we know cranial 11 is intact. Okay. Look at me and move your head from side to side. Does that hurt at all?
No.
Okay, how about down and up? Does that hurt at all?
No.
Okay, go ahead and hold your arms out. Can you lift them all the way up and back down? Okay, moving around. Range of motion. Okay, what I want you to do is while you try to lift them up, I'm going to press down. So resist my pressing. Go ahead and lift them up. Okay, great. Same thing here. Go ahead and now what you're going to do is you're going to try to bring your arm in and I'm going to fight you here. Okay? Okay, go ahead and try to bring it in. Okay. Oh, I almost brought my table. Go ahead and bring it in. Great. Okay. And do the same thing with your legs, okay? Just keep your legs straight. I'm going to press down and I want you to try to kick your knee up, okay? Go ahead. Good. Okay. This one. Great. Okay. Oh, you know what? I'm going to do something else. I'm going to feel for all your pulses here, okay? Good. Good. I don't even know, you've got such big muscles here. I don't know if I can feel your pulse here. That one's a little hard with your muscles. Okay. I'm just feeling all the pulses that I forgot to feel in your, when I was listening to your heart there. Okay, I'm gonna feel for the pulses in your feet. Okay. Okay. I'm gonna watch you walk, so go ahead and stand up for me. Okay. And I'm gonna have you just turn toward the wall and just walk straight back to the wall. I know it's a little bit hard to get there, but okay, turn around and come back. Okay, have a seat. A couple other questions that I forgot to ask you, okay? Immunizations, vaccinations. Have you had all of your vaccines that you know as a child?
Yes.
Okay. Does your old physician's office have a record of those?
Yes.
And could we get a record of those?
Yes.
Okay, great. When was your last flu vaccine?
2022.
Okay, so it's been a couple years. Have you ever had the shingles vaccine?
No.
Okay. What about, when was your last tetanus booster?
A long time ago.
Okay, so you're due for that. Okay, great. Okay, so you look great.
Thank you.
Pretty healthy. You're welcome. I'd like to go ahead and I'd like to get your vaccines updated. So today I'd like to, before you leave, I'd like to make sure you have your flu vaccine, your tetanus booster, and the shingles vaccine. You're over 50 years old. That's the recommendation. That'll be 2 doses, and the second dose we'll go ahead and schedule for about 3 months out. So it's anywhere from 2 to 6 months, so I just kind of pick it right in the middle, so 3 months out, okay? Because you have high cholesterol, I can, of course, once I get those records, and I can go in the computer and look up what your lipids were. I would like to get that repeated though. I'd also like to get a CBC, a metabolic panel, hemoglobin A1C. Any history of diabetes in your family that you're aware of?
No.
Okay, but I'd still like to get a hemoglobin A1C. We'll get a urinalysis. Have you ever had a PSA?
No.
You have not. Okay. So that is going to check for, basically it's a prostate screening, okay? And if I were to do the prostate exam, which I'm not going to, that is a rectal exam where I would actually feel the anterior surface in the rectum and feel for the prostate. It should kind of feel like a pencil eraser, okay? You're not reporting any symptoms of BPH, which is where the prostate becomes enlarged. And usually that's pretty common after age of 50 for men. So that's great that you're not doing that. As far as exercise go, we didn't even talk about your exercise history. I apologize. Can you tell me about that?
Exercise most days.
You exercise most days. About how many days a week?
Oh, okay. I would say 4 out of 7
Well,
days.
that's 4. That's most.
Yeah.
Okay. And what type of exercise do you do?
Strength and a little bit of cardio.
Okay. Strength and cardio. Okay. Do you walk? Do you run? Do you
walk?
Okay. Okay. You got pets? Do you walk a pet?
Yes,
Okay.
the one that walked in.
Oh, the one that walked in. Yes. Okay. Okay. So yeah, once we get those labs back, so like I said, we're going to draw some labs. Once you can look up the results of those. Usually if there's an issue, we'll call you, okay? You'll also see some notes in your chart.
Okay.
You know, our system is my chart, so you can go in there and you can look up your own results. You can look at what the norms are. If there's anything that I'm concerned about, I will document in there. If there's anything I'm really concerned about, I will call you and we'll have a follow-up visit then and we can talk about it, okay? I'd also like to check your vitamin D level, okay? Sometimes you can be a little bit deficient in vitamin D. You don't take a vitamin D supplement at this time. You said you take a multi.
Multi.
Do you know how much vitamin D is in that multi?
No.
Okay. Okay, continue your exercise. Ideally, I'd like to see you increase that to 5 days a week. I'd like you to do a minimum of 30 minutes of moderate cardiovascular exercise 5 to 6 days a week if you can increase that. I know sometimes life gets in the way and that's tough, but if you can, that would be great. That'd be ideal. Not a big fruit and vegetable eater. I know you eat them, but if you could increase that to 3 to 4 servings a day of fruits and vegetables, okay? Continue your water intake. You're doing great on that. Whole, unprocessed foods, lots of lean meats, fish, legumes, whole grains, things like that, okay? You're doing great. You have very little going on for someone your age. You're not taking any medications. That's fantastic. Prevention and health maintenance is kind of the name of the game right now, and we'll just attack things as they pop up. Keeping up on your immunizations and vaccinations are also a good idea, okay? We talked about the colonoscopy. We don't have to worry about colorectal screening right now. Do you have any questions for me? Do you have any concerns?
I do not.
Okay. All right. Well, John, thank you for coming in today, and we'll be in touch.
Thank you.